Good afternoon, everyone. This is a live Facebook broadcast entitled "A Community Talk." Good afternoon, everyone. This is a live Facebook. The title of our community talk today is Rutgers NJ Medical School and Newark, Perfect Together, or Perfect Together. We welcome all of you from the community. We needed to have this conversation, a public conversation around the Rutgers University, so that people are aware of what is happening in our community. So I want to first introduce myself. My name is Deborah Smith Gregory, and I serve as the president of NAACP Newark, New Jersey. And I am serving as the co-moderator for this community talk along with Larry Ham.
Good afternoon, everybody. My name is Larry Ham. I'm the chairman of the People's Organization for Progress. The People's Organization for Progress is a grassroots, all-volunteer organization working for racial, social, economic justice, and peace. And in the interest of full disclosure, we have fought against hospital closures and will continue to fight against hospital closures. We fight against reductions in services at hospitals in our community, and we fight for improved medical services in our community. And like the NAACP, we are pressing for the full implementation of the Newark Accords.
Thank you, Larry. And our guests this evening are Dr. Jonathan Holloway. And so many of you in Newark, this may be your very first time meeting Dr. Holloway. He is the 21st president of Rutgers, the State University of New Jersey, which consists of campuses in Newark. We all know Rutgers, Newark, New Brunswick, and Camden. He is an eminent historian and an elected member of the American Academy of Arts and Sciences. He took on the presidency July 1, 2020, just before this pandemic. And so we have not had a chance to really meet and greet him in person, but welcome this opportunity to have this conversation with him. Our other person that is going to be talking to you about Rutgers is Dr. Brian L. Strom. He is the inaugural Chancellor of Rutgers Biomedical and Health Sciences. The Chancellor has primary oversight for Rutgers Biomedical and Health Sciences, which includes academic, patient care, and research facilities in Newark. Most of you here in the community probably know New Jersey Medical School because you use the dental school. He also oversees the dental school, the School of Public Health. We may have some people who have attended the School of Nursing as well. And so we have a short period of time, so we're going to jump right into our questions. And I just want to show everyone this. This is my famous timer, right? And what we're asking, we're trying to get through as many questions as we can. We want to ask from the door that we have other conversations, but this evening we want to get through some questions that have been raised amongst this coalition and the community. So I would ask that your answers be succinct, concise, and to the point. Okay. Larry, you have the first question.
All right, my first question to Dr. Strom, with regards to coordination between the campuses, the two schools, have any of the classes, degrees, programs, certificates been moved out from the Newark campus to another campus, or moved from the Rutgers Biomedical Health Services campus to the main Newark campus?
No. You wanted a brief answer. Nothing has been moved out of our BHS to the other campuses. We share with the Newark campus. We have expanded a lot of expansion of work that we do jointly with the Newark campus. School of Public Health, for example, works jointly. Our School of Health Professions works jointly with the Rutgers Newark campus. There are others as well. Our School of New Jersey Medical School works jointly with and probably all of our other schools do also. I'd have to check with them. We have a lot of interaction with Rutgers Newark, and a lot more in recent years. A lot of working very well between the campuses. No programs have been moved out, but rather programs have been expanded.
And any future plans in that regard?
Again, no. Again, our plan is to expand, not to constrict.
Oh.
So Dr. Strom, I would like to follow up. There were talks of a merger, and the community was very concerned about that. Is the coordination of a merger off the table now, merging the New Jersey Medical School in Newark and the New Jersey Medical School in Piscataway, New Brunswick?
In New Brunswick, yeah. So let me answer. This one's not quite as brief as an answer. We have a dean of the medical school now in Newark, who is also interim dean of the medical school in New Brunswick. We have just launched a search for a new separate dean in New Brunswick, as a separate dean from the dean in Newark. And we've just, that's public, and we've listed who the committee is includes community representation and so on as part of that. Sometime in July, we will launch a process between the two schools of looking about coordination between the two schools, ways that they coordinate, ways that they're not coordinated. So for now, let me be clear, from now, the merger is off the table. I can't promise whether or not that will happen in the future, but at no time, no matter what happens, with whatever coordination or any merger, no programs will get moved out of Newark. If anything, as the schools coordinate, it increases the offerings in Newark, because we can now offer things in Newark that came from New Brunswick, or more likely new things where there are not enough patients in either city to support the development of a new program. We can develop new programs where some of the faculty work part-time in one place and part-time in another place. So again, our plan is not to move anything out of Newark ever. The plan is to expand. Thank you.
This question is for Dr. Holloway. Prior to you coming, Dr. Holloway, there, and also Dr. Elnahal, the residency program saw a diminishing of resident programs. Are there any plans to replenish the residency program spots at University Hospital that have been reallocated to other hospitals? And the second part of the question is, has Rutgers thought about how Rutgers can assist in the support of the study, the building, and the long-term support of University Hospital in light of their announcement of acquiring funds for a new hospital?
I'm sorry. I'm happy to make stabs at the answer, but really that really is an answer best left to Brian Strom. What I will say is that Dr. Sharif Ellenhall and I met early on in my time here. I've yet to meet him in person, but that's just all a factor of COVID. And he and I hit it off immediately. He's quite remarkable and really does care deeply about UH and the Newark community, as do we. So from that level of one executive to another, I feel it's all about partnership and looking for the possibilities of growing together. And you've heard from Dr. Strom, it's about trying to expand services. One thing that Dr. Ellenhall and I did talk about, but then I said you need to have Dr. Strom and other people in the room, since they are the frontline people on these issues, is about the importance of expanding community health services. Now, I may not get the technical terms right, but it sounds more like clinical care, ambulatory care for the Newark community. But that's what I've talked about. I'm in no position to offer any insight into the residency allocations. That's really Dr. Strom's world, and really maybe the dean's, Dean Johnson's world. So if I may, I'll just turn it to Dr. Strom to follow up.
Yeah, my pleasure. In terms of residency programs, the residencies have been increased. And in fact, we have contractually agreed with the University Hospital that they have first dibs on any residency slots that they want, that they're paying for. And in fact, it was never an issue, because the reason the hospital residency slots had decreased is because the hospital said it didn't want them anymore. As far as we're concerned, this is in a written contract that the hospital can have any residency slots that it wants, that it's paying for. We're happy to provide to it. It's only good for us as well to be able to expand residencies in Newark, and that is the plan, to be able to expand. In terms of, let me give a slight tangent to make, because it's consistent with the theme of the question. We have multiple programs that we are working on now to expand in Newark, or maintain or expand in Newark. So we have a cardiac surgery in the University Hospital. The volume is too small and is at risk. And so we've been able to encourage our partners at RWJ Barnabas to provide coverage to help University Hospital, so that the cardiac surgery program at University Hospital can be protected, so that it does not need to shrink or become unsafe, which would be the problem if there wasn't coverage. We're increasing ENT coverage the same way, in partnership with Barnabas. And we're very far along in discussing ways to increase cancer services along the way, specifically at University Hospital. We also partnering the two together in terms of transplants. In terms of construction, you asked about a new building. We are certainly very supportive of the idea of building a new hospital, a new University Hospital. I was there at the press event to help Sharif lobby for it going forward, and we're very supportive of the idea of building a new University Hospital. Obviously, there needs to be state funds to be able to support that. The state has, in its budget, looks like it's providing funds to help plan for that. We'll see what happens in terms of funds to build it. But Rutgers is certainly extremely supportive of that. Again, we are tied very closely at New Jersey Medical School and the dental school, as you alluded to, and other schools with the University Hospital, and it's only good for both institutions for there to be a more modern, up-to-date, more capable University Hospital. So we are very, very strongly in support of that, and we've made that known and publicly.
Thank you. Larry?
My next question has to do with behavioral health. During the past year plus, we have been in lockdown due to the pandemic, and we've seen an increase in drug use in the community and resulting overdoses, increased alcoholism, domestic and gun violence in our cities. But at the same time, it's our understanding that there has been, the staffing levels have been diminished in behavioral health services. Now, with these increase in patients in these various areas, what are the plans to, in fact, increase the staff, the mental health professional workforce, to deal with this increase in demand? If there's an increase in demand and we have a decrease in staff, obviously the staff is going to be overworked and their morale is going to be low, and many of them might even be traumatized because of this COVID crisis. So part one of my question is, how can the mental health professional workforce be expected to provide quality services to their patients while we are decreasing the staff levels? And what, if any, efforts are going to be made to bring them back up?
So great question. Clearly, this is a problem locally, Newark, statewide, nationwide. You're completely correct. What happened due to COVID is a lot of care moved to telehealth. So a lot of the care was being provided via telemedicine. And the staff that was needed to provide care in person, there wasn't work for, because the care, there was substantial decrease in care provided in person. The total care we provided actually increased by telehealth, but the in-person care decreased. The in-person care is being increased as we speak. We hope to be closer to full occupancy in terms of inpatient care July 7th, though it's going to be a gradual process through the summer. There'll be a big increase July 7th and a gradual increase through the rest of the summer. And obviously the staff that'll be needed to support that in-person care will be increased along with that. But again, to be clear, the actual professional psychologic social work care increased, didn't decrease. But what decreased was the need for supportive staff for that, because the in-person care decreased.
Similarly, with regard to psychiatric services, we've seen an increase in patients and a decrease in staff. So what steps are being taken to address this, to ensure the safety of both the patients and the staff?
Yeah, again, the answer is the same. Most of psychiatric care shifted to telehealth. Neither patients nor staff wanted to come in person and be exposed to COVID if they didn't need to. And so the clinical staff, the professional staff delivering actual care, continued and delivered their care as well as they could by telehealth. This is being restored as we speak, much more over the summer, but it's a gradual process, but it's certainly happening and going forward. I don't mean to give the wrong impression. There is certainly a shortage of psychologists, social workers to provide care, certainly in Newark, across the state and across the country. But certainly we are gearing up to provide it as fast as we can and as fast as we can hire people. The rate limiting step is in terms of the professional staff is how quickly we can hire more people. And with that, the existing staff, other staff will be hired to support them as needed.
Just to follow up, is there a transition plan to move back to in-person operations as opposed to telemarketing?
Yes. And again, it'll be dictated to a large degree by patient desires and patient demand. As a university, and Dr. Holloway could certainly speak to that, we are moving to in-person and to fully staffing our campuses July 7th. Our students will, across the state, will be back by the fall. Our students at RBHS are back sooner than that. In fact, most of them never left because we're providing clinical care. So we will shift from telehealth to in-person care as quickly as our patients want. It's happening as we speak. And there are a lot of patients who prefer to get their service by telehealth. There are others who do not. And so we will use our professional staff to provide staffing in person or via telehealth based on demand.
So are you saying that there is a plan to increase staff levels or not?
Yes. And
There is a plan.
There is a plan, yes. And there is also a plan to increase staff levels, the balance of in-person to telehealth. That it, as the COVID pandemic goes from being as acute as it was to something more chronic, more of the care will shift back to in-person care.
Deborah.
I would ask Dr. Holloway, Dr. Strom said that you might be able to speak more to that transition plan as a whole, as the president of the university.
Sure, happy to. So back in the spring, I want to say late March, I believe, we announced that Rutgers would require would mandate the vaccination of our students if they wanted to come back and register as students. We recently, I think earlier this week, front-facing healthcare population, those who are already required to receive the flu vaccine, are now mandated to get the vaccine. So these are critical pieces about how we return in person. We are encouraging our faculty and staff to get vaccinated. We have not yet mandated that though, although since we are in a high vaccination state, certainly as compared to other parts in the country, we are still debating whether we need to make that a mandatory move or not. We haven't made a final decision on that point, but we will be returning to as much as normal. Not that you must realize, of course, I've never seen normal in Rutgers since I came here during the pandemic, but in Newark and Camden, populations, classrooms will be back 100% in person. New Brunswick, because of its size, is a little more complicated, but close to 75% of the classes will be in person. And then the administrative staff that are in support of that will overwhelmingly be coming back in person. I've also charged Vivian Fernandez, the head of our system-wide HR, should be leading a task force on the future of work at Rutgers, wherever it's expressed, to think about, I think it's about the task force over 100 people when you figure in subcommittees, that'll be examining the lessons that we learned from the various types of work how we pursued our work at Rutgers during the pandemic. And so they'll be making recommendations to me in a year's time about what work looks like at Rutgers, broadly speaking. This is going to be evolving just because we are all learning as we go along at Rutgers and society in general about how we proceed, hopefully as safely as possible.
Dr. Holloway, the Robert Wood Johnson Barnabas Health and Rutgers launched a private-public partnership under the former President Barachi. Can you provide us with any type of update about where that partnership is?
Brian Strom is the one who should provide that update, and I know he can.
Yeah, it is proceeding. We have signed a follow-up agreement with RWJ Barnabas, RWJ and RWJ Medical School for New Brunswick faculty for the coordination between the two. We are working on a comparable agreement now for CINJ, though both of these agreements, to be clear, carve out University Hospital. That is, University Hospital is not included and is protected, except to the degree it wants to be included. So the degree to which University Hospital wants to be part of the partnership or not will really be up to University Hospital to decide. Our program with RWJ Barnabas Health is continuing. They are managing the clinical care provided. It began in January in New Brunswick only, and they are providing resources to us to invest in to be able to hire new faculty in the process.
Thank you. Harry, do you want to talk about diversity?
Yes, very much so. Um, my immediate question, because I know we are within a time constraint.
Yes.
What guarantee does the community have that Rutgers will honor any aspect of the Newark Accords with regard to recruiting African-American students and faculty? What steps are you taking to ensure that this initiative is advanced?
Well, I think Nancy Cantor has been quite strong in this, but the Chancellor of Rutgers Newark has been quite strong in this case. I might get the name of the program wrong, but I think it's Run to the Top, which is specifically, this is for undergraduate students I'm talking about, specifically focused on the New Jersey community, the Newark community, and to get them, that population interested in, learn more about Rutgers Newark, and track to attend Rutgers Newark. She's extremely committed to that work. She's also committed to, she's a leader within the university about being committed to local vendor relationships for supplying the university. So I'm talking just about Rutgers Newark here, not RBHS up in Newark itself. So the commitment is quite real, and it's not just Nancy Cantor, it's just that she's up in Rutgers Newark, but it's in the entire university.
Now, one of our viewers just sent something to us that I think is relevant. Is this true both at the graduate level as well as the undergraduate level?
Well, at the graduate level, it becomes more complicated because it's what graduate program you're talking about. I do know sort of in between, there's this, I just know the acronym now, I can't think of, it's ODASIS, Office of Diversity. I'm forgetting the rest of the acronym, but it is about training Rutgers undergrads, tracking them from underrepresented minority backgrounds, training them for medical school. And in fact, I got an email just today from a DASIS student who's a senior at Rutgers, New Brunswick, talking about his excitement and being and appreciative of support he's received as he's preparing to apply for medical school in the fall. So the ODASIS program is pretty wonderful, and I think is actually pretty sparkly gem as far as how Rutgers is caring about diversifying the medical school population specifically, whether it's at Rutgers or beyond. When it comes to graduate programs, we have so many different types. Graduate admissions is run locally, like at department level and at school level. So there's no simple answer for it. But I believe deeply in the importance of diversifying the academy. And that's a decades-long project. I mean, I was part of it myself when I received funding for grad school 30 years ago. And it's taken this long for me to rise to this particular position. So you've got someone who deeply believes in this, and it's quite uneven in our graduate and professional schools about the quality or the extent of the diversity there. But I have a new executive vice president for academic affairs who is launching an initiative that we'll be announcing, I think, in the summer, that one of the components is about increasing opportunities for graduate fellowships, postdoctoral fellowships, and faculty opportunities for diverse communities.
I can't verify the veracity of this, but it is something that was said to me, but perhaps you can, that there are fewer African-American students in the graduate school today than there were 10 years ago. Is this true as far as you know?
I actually don't know, to be honest. That it may well be true. I mean, because the numbers fluctuate in many ways. There is, what I will say though, is that, because my track record starts going forward now, that for the undergrad, again, I know the question is about grad, but for the undergrad, we changed a number of dynamics under my direction, and we're going to be seeing significant increases in the Black and Latinx community coming into Rutgers, New Brunswick, which has the furthest to go. Newark and Camden already do really quite well in those spaces. So I do believe I'm going to be part of a force for change in this regard. Like I said, I wouldn't be surprised. I wouldn't be happy about it, but wouldn't be surprised if the numbers were lower. I know in earlier part of my career, the numbers of faculty where I was teaching then in the 90s or early 2000s was lower than it was in the early 1970s. The numbers are not great. We all have to do better, period. And I'm certainly committed to that work.
I have worked in the diversity area for a couple of companies over the years. And one of the things that I always was concerned about was that when we pushed in the 60s for these programs, minority recruitment programs, they were specifically aimed at recruiting African Americans and Latinos from the local communities. Over the years, the universities have, in a very subtle way, or maybe not so subtle way, transformed it from recruitment of inner city minorities to diversity of all colors and international students. And the end result has been the people for which the programs were initially created were in fact the least of the beneficiaries. And I'm very concerned about the emphasis on African-American students and Latino students from Newark, from New Jersey. You know, this is also true with regard to minority contracting. When these minority contracting programs were created, they were actually created to try to increase the numbers of African-American vendors getting contracts from government and public sector institutions. And when we examine these programs today, we see that African-American business people get the smallest share of the contracts. Is Rutgers examining this from that point of view?
Absolutely. I agree with your analysis, Larry, 100% as far as what you saw at the beginning, you know, when you were doing the advocacy work and what evolved. I agree with you completely. And I think you know that right when I came in the door, I did the first audit of the university's central administration. So start at the top to see what the difference between our words and our actions happened to be. That was conducted this 11 months ago. It started right after I began, and established the first senior vice president for equity, which covers the breadth of the university, touches all parts of the university. She is in the final stages of developing a strategic plan when it comes to diversity, equity, and inclusion. And a lot of those pieces will start to launch in the fall. She is also involved in the faculty, postdoc, and grad student diversity package that will be revealed in late summer or fall as well. So change from the Rutgers perspective is coming. I think positive. I'm committed to it. And as I already said, Nancy Cantor has been a leading advocate on these issues through various programs over the last handful of years.
The other thing, just in follow up, Larry, in terms of your questions, both Rutgers Newark and we at RBHS have been very active participants in the mayor's Newark 2020 program. You were talking about purchasing, and in fact, in almost every way, have exceeded the targets and the goals that we're committed to, and a large part of that, to be realistic, comes from us. There are things we can't get locally. That comes from us at RBHS. There are things we can't do locally. We can't buy vaccine, for example, manufactured in Newark. So there are things that can't be purchased locally. But in fact, in hiring, for example, we're way ahead of our targets in hiring locally.
Perhaps the next time we get together, you could bring some numbers in, so you know we could see the numbers.
Happy. They change continuously. They change continuously. Obviously, they go up continuously, and I'm happy to bring whatever the current numbers are you'd like to see.
Right, Deborah,
Dr. Strom, yes, Dr. Strom, I think this is a question for you. It keeps coming up. the healthcare personnel in light of all of the racist trauma that has been stirred up over. I mean, it was continual, but it has really been flushed up. Is there a specific training for the healthcare personnel to recognize the trauma of racism?
There's certainly a specific training. Essentially, yes, but let me be more clear about that. As Dr. Holloway was talking about, the university at large has a very large commitment to diversity, and much more so under his leadership. There's a whole series of different training programs that are done accordingly. Again, keep in mind, University Hospital is not under our control. It's a separate hospital. I can't speak to the training done at University Hospital, but there's certainly a lot of training in racial sensitivity. And again, to be clear, a lot of discipline applied when people aren't behaving correctly.
Well, particularly with the behavioral services that are being provided and the mental health with the social workers and the fact that there is a short staff, it becomes extremely important that those healthcare professionals who do come into contact with residents who have mental health challenges, and some of it being rooted in this systemic racism and the trauma of racism, and it projects itself in different ways. It becomes very urgent for them to have a training and a conversation. And I would offer both People's Organization for Progress and NAACP Newark, New Jersey to come in and have conversations with the healthcare providers about how to deal with that. I know that oftentimes it has to be that someone is, quote, certified through the institutional way, but institutional racism has to be attacked in various ways. And so we offer that to you. And we know that we're getting to the end of our time. What we would like to do, because the community really has not met Dr. Holloway, we would ask that you make any closing remarks that you would like to make to the greater Newark community.
Thank you. So the remarks that I would have structured my remarks around what I said just a few moments ago. So forgive me if I repeat myself a little bit. You know, one of the reasons I put my name in the hat, one of the leading reasons, put my name in the hat at Rutgers after essentially a career at private universities, is that I was inspired by what I saw at Rutgers as far as its established commitment to supporting students no matter what their background is and what their family college going tradition happened to be, what language they spoke, et cetera. It struck me as an opportunity to be of service to a university that had established a history of service. Now, I understand there's a lot of criticism about Rutgers. I've been in numerous conversations about various sore issues since I started, but I must say what I saw from the outside as a potential candidate when it came to issues of diversity, equity, and inclusion, the possibilities were very exciting, and the possibilities of an institution being a public good was very exciting to me and remains exciting to me. And you know, I've used this phrase quite often, and I mean it quite sincerely, is that I was inspired by the democratic possibilities of Rutgers. Is it perfect? No, not even close. Rest assured, I've seen a lot in this last year that's frustrated the heck out of me, and I'd like to see improve, and I want to see us to be a better citizen. But I will say that, you know, I am committed to being that good citizen and to leading a senior leadership team that understands that it's a driving principle for the way we're going to operate. As I mentioned before, I opened, you know, coming in the door, I talked about the importance of conducting equity audit, staffing at the highest level of the university, a senior vice president with equity as a mandate, as a portfolio. I have I'm actually quite proud of living, putting my actions, where my words are in this regard, and have been unapologetic about a set of values that I see at Rutgers that are important in higher education generally. And that really is that excellence can be found everywhere. Excellence is not owned by particular skin color or gender or sexuality. It can be found everywhere. And if we aren't looking for it everywhere and cultivating it everywhere, we're doing a disservice to ourselves at the local level, the state level, and the national level. So Rutgers is a big place. It's got its flaws. It does a lot of things that are really good, though, and really with best intentions. And I'm committed to doing what I can to make sure those best intentions are amplified, those areas of need or where we fall short are addressed, and that we will be, in all things we do, be a good citizen to our local communities. Absolutely.
Thank you, Dr. Holloway. Dr. You want to respond? You want to respond, Larry, before Dr. Strom?
I actually wanted to put a question to Dr. Strom, and maybe he could weave the answer into his closing remarks.
Okay.
I'm concerned about the mission support payments that Rutgers is supposed to be receiving. I was wondering if Dr. Strom could provide an accounting for how this money is being used and how much of it is reaching the citizens of Newark.
Yeah, so firstly, let me comment. Obviously, I agree with everything Dr. Holloway said. And I wanted to say, if you have additional questions vis-a-vis behavioral health, and specifically about behavioral health, I'm happy to come, or you, with or without me. Frank Ganassi runs our behavioral health program, and he could answer a number of the questions more specifically than I did. The purpose of the mission support that we get from RWJ Barnabas Health is to recruit new faculty, and particularly new tenure track faculty, research faculty. And what I can tell you is a disproportionate number of them have been hired into Newark, and into New Jersey Medical School, in particular, to support the activities. And the particular strength New Jersey Medical School has academically is infection and inflammation, and obviously that became extraordinarily critical and useful as COVID happened, going forward. But the contributions that we were able to make to the community, to the state, to the country, and in treating patients, obviously first and foremost. But in terms of your specific question about mission support, the goal of it is to very specifically, very narrowly, to recruit tenure track faculty to our medical schools.
Larry, you want to make closing remarks, brief closing remarks?
Well, I thought they had the last word.
No.
But well, in turn, I hope that this is the beginning of an ongoing discussion. We saw a number, because we had a 45-minute parameter here, and we couldn't really get to all the questions that people have. But I hope that this is the beginning of an ongoing dialogue. We are very much concerned about the hospital in Newark and about hospitals throughout the state of New Jersey. COVID has really highlighted the importance of these institutions in our communities. And that's why we're fighting hospital closures and we're fighting reductions in services. So I hope that this is the beginning of an ongoing dialogue so that we can ask the other questions that people put forward today.
Can I make two other comments and follow up if we get to have the last word? Sorry.
I just want to say who the concerned citizens are, but go right ahead, Dr. Strom.
Yeah, I just wanted to echo, we very, very much agree with you in terms of protecting University Hospital. And I'm delighted to tell you, I assume you know, but just to be sure, University Hospital is actually in much better financial shape than it ever was before. It's doing well, patient safety wise, financial, and the state budget includes an extra $20 million for capital, for construction as well. So University Hospital is doing well. We're doing our best to expand programs at University Hospital. I gave you some examples of that earlier. Last comment I wanted to make is thank you for initiating this dialogue. I think it's of critical importance, and certainly I'm happy to continue it anytime you would like.
So, and our ask of Dr. Holloway and you, Dr. Strom, is that we would like to have another roundtable or community talk with Dr. Elna Hall here. And I know that there is almost like a sacred separation of church and state that you don't mix, but this is so important that we need you here. We also know that Rutgers Newark does not necessarily have anything to do with the New Jersey Medical School or the hospital, but we need all hands on deck. We need to have a conversation with the Chancellor here, with Dr. Elna Hall here, with Dr. Strom here, with the gentleman who you said is the head of the behavioral sciences, and you, Dr. Holloway, as the head. That's what our ask is. For those of you who are on Facebook and you did not get a chance to get your questions in, please feel free to reach out to POP or NAACP. I would like to give you a couple of numbers that you can call. POP is actually having their meeting after this meeting tonight. You can reach Ingrid Hill at 973-951-3369, or you can call NAACP Newark, New Jersey at 973-624-6400. The Newark Coalition of Concerned Citizens, we want you to know who they are. They are 23 labor unions across the state. They are the People's Organization for Progress, NAACP Newark, New Jersey Communities United, New Jersey Appleseed, and New Jersey Citizen Action. We've come together collectively because of our concern for our community. Some of us, the NAACP and POP, we are volunteers, but we still support the unions where residents work for the hospital, work for the campuses, and we have to come together all as neighbors. So please let us know when we can have that opportunity to have another roundtable discussion with Chancellor Cantor, Chancellor Strom, the gentleman from the behavioral science, and Dr. Holloway. And we will certainly make sure that the community is aware of an opportunity to ask questions in general.
Thank you very much.
Thank you. We kept our time, we kept our word. So now you will come back. Good night to everyone. On behalf of People's Organization for Progress, Newark NAACP, and all of the members of the Newark Coalition of Concerned Citizens, we say to you, good night.
Good night, everybody.
Good night.
Good night.